I'm excited to share a new series of clinical reasoning case studies titled Clinical Dilemma Activities that emphasize clinical reasoning as well as the art of nursing and the importance of caring for each patient holistically, not only just the physical body, but also the spirit and the soul as well. It has been my observation that nursing education does a very good job emphasizing the science of nursing, but the art of nursing that includes caring, compassion, and spiritual care is often not intentionally integrated, but assumed that students will get it like osmosis. I have created these short exercises that can be easily adapted into both the classroom and the clinical settings in post-conference that emphasize the most common themes where the art of nursing is a priority and is needed. This includes patients who are significantly depressed, anxious, or in spiritual distress. The use of these activities will allow students to practice and then integrate the art of nursing into their care. They also emphasize key aspects of clinical reasoning, which includes being able to identify the essence of the clinical situation, as well as identify what clinical data in this scenario is most important or relevant, as well as what is the nursing priority, and then what will you do with the plan of care. So let's begin today's topic, an anxious patient, but why? And here is our scenario. John James is a 77-year-old man who had coronary artery bypass graft surgery 3 days ago for multivessel coronary artery disease. He lost over 1,000 milliliters of blood shortly after surgery due to a bleeding graft site and almost died as a result. He is currently off all vasoactive drips. His arterial line has been discontinued and he is clinically stable. He is scheduled to transfer to the cardiac step-down unit later today. Personal and social history. John's wife died 6 months ago after 50 years of marriage. He lives alone in his own apartment. He has one son who lives in the area and checks in at least once a week to see how he is doing. He is a Vietnam War veteran who has not been active in his church since he returned from the war over 40 years ago. So let's look at an important aspect of clinical reasoning and say what data from these histories is important and relevant, therefore it has clinical significance to the nurse. Well, as I look at this scenario, it must be noted that the relevant data that emphasizes the second point of clinical reasoning is this. He lost over 1,000 milliliters of blood and almost died. That's significant because there's some psychosocial implications with any patient who has had a near-death experience as a result of a complication of major surgery. The second piece of relevant data is that he is currently off of all of his vasoactive drips. His arterial line has been discontinued and he's scheduled to transfer. And all of this data is expected as he is improving, but it's important to note that his status is clinically stable. Let's look at relevant data from the social history. His wife died 6 months ago after 50 years of marriage and now lives alone in his own apartment. Now, this is clinically significant because the death of a spouse is one of the most painful and most stressful psychosocial events that a person can experience. And this was fairly recent. And it was not only after just 1 year of marriage, but 50 years of marriage. And therefore, that must be noted by the nurse. It must also be noted that he has a son who lives in the area and checks in on him at least once a week. And this is important to note because though he is alone, he does have psychosocial support by his immediate family. And the third piece of data in that psychosocial history is this. He's a Vietnam War veteran who has not been active in church for the last 40 years. And though the chart doesn't suggest a reason why, it's important for the note to recognize that it is likely that he experienced combat experience and as a result experienced some PTSD or other aspects of psychosocial distress related to his service, and that those two may be related. So let's go to our dilemma. In this context, John now puts on his call light. As you enter the room, he states he feels short of breath and is visibly anxious. His breath sounds are clear, and his O2 saturation is 98% on 2 liters nasal cannula. His respiratory rate is 20 a minute, and his heart rate is 78 a minute sinus rhythm. He acknowledges that he is anxious and feels like he's having a panic attack, and he has never felt like this before. When you ask if there's anything that he may be anxious about, he begins to share the following. I used to go to church when I was little, but when I saw so many of my friends die in Vietnam and I was helpless to save them, how could I believe in a God who allowed such horrible things to happen? Before the war, I could not even kill a cat or a dog. In Vietnam, I killed so many people. How can I be forgiven for what I have done? Now, as we look at this piece of clinical data, and looking again, using the emphasis of clinical reasoning, and what clinical data in that statement and in all of that cluster is relevant, the nurse must note the following. He states he feels short of breath and is visibly anxious. And as you look at that, what's the most common complication of major surgery? It's a pulmonary embolus. Therefore, this must not be blown off as an emotional issue or anxiety, but first must assume it could be physiologic in basis. But as you complete your nursing assessment, that includes a full set of vital signs, you note that his breath sounds are clear, his O2 saturation is not hypoxic, but 98%. His respiratory rate is not tachypneic, but at a rate of 20. And his heart rate is normal at 78 a minute sinus rhythm. There is nothing in the clinical data suggesting a physiologic problem. And therefore, that's the significance of your thorough assessment and beginning to kind of think that this could be more emotional versus physiologic. And as you go down further, he states that he's anxious and he feels like he's having a panic attack and has never felt like this before. Now, again, he's feeling that anxiety and feeling that panic anxiety, but it's reflecting that he likely has, again, anxiety as the primary component. The question is, why? And so therefore, when you ask him about what he may be anxious about, and he shares his experiences in Vietnam, this is significant as well as tragic, because this represents a clear, not only an emotional or anxiety, but also spiritual distress must be recognized as the underlying problem in this scenario, and what can be done to support the patient in this context. So now we're going to go to the third aspect of this dilemma. We're going to attempt to resolve this dilemma with a series of 7 simple steps that the nurse must be responsible to do. The first step is this: identify data that is relevant. What is the essence of this current dilemma? So as we've looked at this scenario, though NANDA nursing diagnostic statements do not always capture the essence of the patient care priority, in this scenario, the statement of spiritual distress captures the essence of what this patient is experiencing in this moment. Second step, what additional information is needed by the nurse that would help clarify this current dilemma? Now, sometimes you may have not enough information and need to gather more by asking other questions. But in this context, he's already shared his aspect of spiritual distress, his need for forgiveness, but yet not having experienced it yet to this point. Step 3. What additional members of the healthcare team could be utilized in this situation and why? And the chaplain is the most obvious and the best resource that the nurse should attempt to utilize. But with matters of faith and religion, the patient must accept and want this intervention. So therefore, it's imperative that the nurse ask the patient for permission to make that referral or that call and then proceed from there. The nurse must respect the patient autonomy in this time. Step 4, identify what is the nursing priority. Now, the essence of this dilemma is spiritual distress, which also captures the nursing priority, but there are other Nanda statements that include hopelessness, grieving, or ineffective coping that also may dovetail and translate in this context. Step 5. What nursing interventions and or principles can be utilized by the nurse to successfully resolve this clinical dilemma? Now, the essence of spiritual care is simply providing hope when life appears hopeless. And it's important for the nurse to recognize that there's going to be times where you may feel incapable or inadequate, but it's the middle of the night and the patient has this response, you're it and you're on. How do you respond at that time? You must recognize that this is an important aspect of the nurse's responsibility as a care provider, and caring for the spirit may at times be a needed priority. Therefore, it's important that the nurse must cultivate their own spirit, because you cannot give spiritually what you do not possess. And so therefore, make it a priority to cultivate that, regardless of what your faith tradition is, so that you have something to offer when a patient is feeling hopeless or in distress. But there are numerous interventions that flow from supporting this patient and showing that you care and that he matters to you in this concept, in this context of this scenario. Some things that I think jump off at me is the importance of nurse presence. Remembering that just your presence, that is caring and engaged and just being there, demonstrates caring. Therefore, sit down with the patient and even use silence. You don't have to say a word, because sometimes there's nothing that you can say, but just your silent presence communicates volumes of caring to the patient and support that he needs in this moment. Also, don't hesitate to use touch if you feel led. Sometimes that just putting a hand on the patient's shoulder or on his hand, if you're comfortable with that and he responds appropriately to that, also communicates caring and is another tool that the nurse could use in this situation. There are also several open-ended spiritual assessment questions that I have found very relevant in practice that I ask my patients when they are in a situation that seems that they are struggling or in distress. And those include, are you connected with the faith community? What is your source of strength, peace, faith in this situation? What spiritual practices are important to you, or what can I do to support your faith? Though most of these questions are effective tools to make a quick spiritual assessment for most patients, in this scenario, most of these questions aren't relevant because he does not have a faith community that he identifies with. But there is one question that should be considered, and that is, what is your source of strength or peace? He may have some personal strategies or approaches that he has used in the past that he could draw upon in this crisis and in this situation. Sixth step, what is the expected response of this patient that indicate that the nursing interventions were effective? Now, because this patient is clearly anxious and even has the physiologic complaint of feeling short of breath, the alleviation of this shortness of breath, being more relaxed in his affect and body posture, would be the most obvious assessments that the interventions of caring, empathy, and support were effective. Step 7. What response by the patient would indicate that a change in the plan of care and nursing interventions are needed? Now, if the patient continued to be visibly anxious, in distress, or in shortness of breath, this would indicate that the support and care that was offered was not effective. Therefore, it would be appropriate for the nurse to do and look at pharmacologic interventions such as lorazepam or Valium to provide a decrease in his anxiety. And that's the essence of this activity. I hope you liked it and could see its value in promoting that art of nursing intentionally in your students. And this clinical dilemma activity is one of 10 that I have an especially priced bundle that integrate and emphasize the art of nursing as well as clinical reasoning in one context. Go to my website, KeithRM, and check the clinical reasoning case study button on the homepage for more information. In addition to these activities, I also have 16 fully developed med-surg topics that also emphasize clinical reasoning and thinking like a nurse. Be sure to check out my other videos on YouTube, on the channel Think Like a Nurse, as well as follow me on Facebook, as well as on Twitter at Keith Risher, RN. Thank you so much for all that you are doing to be a part of the needed change and transformation in nursing education. Thank you.